what exactly happens. Forget about this location, sir. Please tell me, if I give an alpha 1 agonistic agent, what will happen to the body of that, what will happen to the human body, right? Basically, alpha 1 receptor, if it is stimulated, number 1, it causes vasoconstriction. Number 2, it produces salivary secretion. Number 3, it produces hepatic glycogenolysis. These 3 different functions can be seen if alpha 1 receptors are stimulated. What about alpha 2? If I give an alpha 2 agonistic agent, what will happen to the human body? The first one, it inhibits neurotransmitter release. It might be noradrenaline or it might be acetylcholine because it's a presynaptic terminal, it's a presynaptic autoceptor. That's why it is going to be inhibiting the release of neurotransmitters. Second one, platelet aggregation. Alpha 2 receptors will induce platelet aggregation. Third one, vascular smooth muscle constriction or vasoconstriction. Alpha 2 also is involved in production of vasoconstriction. The fourth one, it tends to inhibit the insulin release. It decreases the insulin release. If insulin release is decreased, what will happen to the blood sugar level? It just shoots up. Superb. So, if the blood sugar level rises up, that's what we need whenever sympathetic system is getting activated. When sympathetic system is activated, it tends to increase the blood sugar levels. Happy? That's it about alpha receptor and its stimulation and what happens to your body. I have given you, I have just decoded all the things for you. Now, let's move on to the beta receptors. Beta 1 receptor, when it is stimulated, 2 functions is there. One, it is there in heart, so it tends to increase the force of contraction, increases the heart rate, increases the conduction. Positive inotropy, chronotropy, dromotropy. Next one, on long standing, it tends to be increasing the renin release. It tends to increase the renin release. Beta 2 receptor, what will happen? If I give a beta, if I stimulate beta 2 receptor in your body, what will happen to your body? First thing, it produces vasodilatation. It causes bronchodilation. It relaxes visceral smooth muscles. It might also relax your uterus. Uterus also will be relaxed. Hepatic glycogenolysis, muscle tremor. All these things are seen if beta 2 receptors are stimulated, because skeletal muscles also contains beta 2 receptors. On stimulation, it is tend to be associated with, wait, I have told somewhere, no, tremors. Remember, initially I have asked about, we are in search of certain questions. The first question was what? Salbutamol. Salbutamol, when it is given, some patients will develop muscle tremors. Why? Because salbutamol is a beta 2 receptor agonistic agent, guys. Is that clear? These are the different actions if we see if beta 2 receptors are stimulated. What about beta 3 receptors? Beta 3 receptors tend to be producing, first one, lipolysis, non-shivering thermogenesis, bladder detrusor muscle relaxation, which means it tend to produce urinary retention. These are the different functions of alpha and beta receptors in your body, my dears. If you have this basic knowledge, it's a cakewalk. Even if I say that I have produced a newer drug, and that drug is going to be is a selective beta 1 agonistic agent, you yourself can say what will be the drug's function, right? So, please be sure that you have a knowledge on what exactly the functions of every individual receptors is, which is there in your body. Because the majority area where the students gets confused is based on the mechanism of action of individual drugs. If you understand the receptors, it's very simple. If you find a newer drug, you just find out in which receptor it is acting. That's it. That's enough. You can find out what action is going to be producing. Clear? Now moving on to the third important type of receptor, that is dopaminergic receptor.